Good evening, and thank you very much for waiting. It's been a long time since we've done this here in this room, so I want to have everybody here together this evening. We're here to talk about healthcare, but what I want to first talk about is the passing over the weekend of the aid package. I want to thank Speaker Johnson and all the members of Congress who worked so tirelessly to get this aid package through. This package is uh, not only for Ukraine, but it is uh, covering other crisis areas in our world, Israel, Gaza, and we really we have to do that. You know, I've always said that we must defend democracy, and this is what this is doing. This is defending democracy, and so. And it also shows that finally, after a long time, we've got a little bipartisanship going on. I know we got a lot more work to do with that, but we got some bipartisanship going on. So I want to thank the Congress for their swift action on this, and I'm looking forward to signing that when it comes across my desk shortly. But this evening, I thank you for joining us here this evening. I want to tackle one of the most pressing issues facing our nation, and that is healthcare reform. Our healthcare system is complex and often inaccessible to too many Americans due to skyrocketing costs and bureaucratic hurdles. Today, we're here to discuss our vision for a comprehensive healthcare reform that prioritizes the well being of all individuals and families across our great nation. First and foremost, let me reaffirm our commitment to assuring that every American has access to quality and affordable health care. No one should have to choose between paying for medical care and putting food on the table. And that and that and that should go without saying. You know, you heard me talk often a lot on the campaign trail uh, about a good friend of mine who is paying $700 for a prescription that she needs, not wants, but she needs. And so we're going to do what we can. My administration will do what it can to lower the cost of prescription uh, medicines, excuse me, and make it more affordable for everyone. Our healthcare plan focuses on several key principles. We aim to expand access to healthcare coverage by making insurance more affordable and accessible to all, regardless of income or pre-existing conditions. We will work tirelessly to strengthen and protect vital programs such as Medicare and Medicaid, which provides a lifeline to millions of vulnerable Americans. And we're going to do what we can to protect those two programs and make sure they do continue. Additionally, we recognize the importance of addressing the underlying factors driving up healthcare costs. From prescription drug prices to administrative waste, there are numerous inefficiencies in our healthcare system that must be addressed head on. We'll work collaboratively with stakeholders across the healthcare industry to implement meaningful reforms that promote transparency, competition, and efficiency. Excuse me. Furthermore, we understand the importance of investing in preventive care and addressing the social determinants of health. By focusing on wellness and early intervention, we can reduce the occurrence of chronic diseases and improve overall health outcomes for individuals and communities. This includes initiatives to expand access to mental health services, which I do truly believe will solve a lot of our problems in our country. I really believe it will. Um, and we will focus on substance abuse and address health disparities that disproportionately affect marginalized populations. Just in closing, I want to emphasize that healthcare reform is not a partisan issue, and it's not. It's a moral imperative that we must set aside political differences and come together to ensure that every American has the opportunity to lead a healthy and fulfilling life by values of compassion, fairness, and equality. And, you know, and I briefly talked about that. I talked about a dear friend of mine back in Texas, and she's a teacher, and we all know how I feel about the teachers, right? You know, we're doing what we can to get them a pay increase, but also um, health insurance. You know, she again, like I mentioned, she has a prescription that she has to pay $700 that she needs. It's not a choice that she wants this prescription, but she needs it. How is that fair? How is that fair when Big Pharma is reaping in billions in profits? We need to have affordable health care, affordable medication. You know, and you heard me talk about this medication. I'm not going to mention a name, but some of you guys may know about the commercial. Guy comes on and talks about how this particular brand of medicine, excuse me, um, at a drugstore is $456, but through this plan, it's $36. It needs to be affordable for every single person in this country. And that's something that we're going to do under my administration. We're going to do what we can to make affordable health care affordable and not out of the reach of so many working individuals in our country. Thank you all very much. Thank you for your time. Thank you. Thank you.